Our focus on this 20-year time frame is that we believe we can actually tackle and largely solve and address with our partners, with a full range of partners, the key priorities the Gates Foundation has today.
Mark, you've got some big news to tell us about. What is it?
Well, the news is, I think, a true milestone for philanthropy and for the world, we hope, which is that the Gates Foundation is going to be announcing that we're committing $200 billion over the next 20 years. Bill Gates will give the bulk of his remaining fortune to the foundation to help enable that in order to actually make dramatic progress in reducing preventable child mortality and saving millions of lives across the world.
Am I right in guessing that what you're talking about is unprecedented, especially for a foundation of the size of this one?
Yes, in a word. There have been foundations that have been time-limited foundations, and indeed we have always planned through Bill, Melinda, and Warren to be time-limited. But until today, the plan had been that we would close our doors after the last of the three of them to die, 20 years after whoever the last of the three of them to die would be. And now we're bringing that forward and saying, actually, we're putting a target. We're aiming for 2045 because we think, based on the lessons we've learned over the last 25 years of the foundation, that we can make a transformative impact over these 2 decades, actually tackle and we hope solve some of the key problems we're working against, and then leave the world better equipped for a new generation of philanthropists to take on a new set of challenges.
Most big charitable foundations are set up to last for a long time and sometimes to last forever. This one will end 20 years from now. What will happen after this foundation is no longer operating? What will happen to all the things that you're working on?
Yes. Well, first of all, we hope that many of the things we're working on will effectively be solved. I know that's an ambitious goal, but we think some of the deadly diseases we're working on will be either eradicated or fully under control. That we believe we will have an array of partnerships in place that will be able to take on some of the critical work, and that's something we'll be very intentional about driving towards. And last but not least, we believe there will be a new generation of philanthropists ready to take on a new set of problems. Our focus on this 20-year time frame is that we believe we can actually tackle and largely solve and address with our partners, with a full range of partners, the key priorities the Gates Foundation has today.
And with regard to the money that you will be disbursing over these next 20 years, am I right in thinking that $9 billion or so a year is the largest amount disbursed by any charitable foundation elsewhere?
By far.
By far.
By far.
Yeah.
It's not even close.
Yeah.
This will be the largest already to date. Our disbursements of $100 billion over our first 25 years, of which $43 billion of that has come from Warren Buffett and $57 billion from Bill and Melinda, is already by far the largest philanthropic donation ever made. Right. And over the next 20 years, that $200 billion at that steady state of $9 billion a year, inflation adjusted, will also be the highest.
It's remarkable. So you're the CEO of this foundation. What is that job? What do you do?
Well, at its heart, the job is, I think, to some degree, the most amazing job in the world. I get to try and help our incredibly skilled staff and our incredibly motivated partners all around the world meet our vision of helping every person get the opportunity to live a healthy and productive life. And I know that sounds sort of big and vague, but it's very real. And the job is essentially, how do we choose how to allocate those resources in the highest possible impact? And I always say impact has to be measured in terms of lives saved and opportunities provided for the person most vulnerable. It is not about money out the door. It is about how it affects people. And so my job is to just help optimize that.
And so this gets to what I think is the central question for the foundation, or any foundation, which is, okay, you have a wonderful plan, or I should say you have a wonderful goal. There are a million ways to reach it, and you have to decide what's the best way. What has been the way you've done that so far?
Yeah. So wait, first we have to start from saying, what is the appropriate role of philanthropic capital as opposed to private or public capital? It's a very specific, it's tax privileged, it's an advantage thing. How can it be put to its best use? And the first thing is it should never substitute for either public or private capital. It should be looking to fill the gaps that either those forms of capital won't fill. So an example would be, and one of the big examples is in research and development and innovation for many of the diseases that disproportionately impact the poorest. Malaria is often a classic example of that. Global malaria research and development is a fraction of what it could and should be given that mortality volume. And yet we're able to come in and be extremely large catalytic funders in that space, working with the private sector, because we work with private sector partners, pharmaceutical companies and others, to tackle or to catalyze the innovation the private sector provides, and then working with the public sector, government, multilaterals, to help deliver those services. But what we do is we look in sector after sector, and we found that global health is by far has been the most impactful of those sectors, but we also work in areas like agricultural development, in education in the US, and in each of those, we will look for where and how we can apply an innovation lens, a risk lens, meaning we can provide risk capital, we can afford to fail in a way that often the private sector accountable to shareholders or the public sector accountable to taxpayers cannot take the risk of failing for the big vaccine trial, for example, or something like that. And so that's really our role. But we've then also constantly got to think about, and how is it going to reach the people who most need those products?
Right. The ambition that you are describing is enormous, and and rightly so. Among other things, it is to eradicate certain diseases. I mean, take them off the earth, gone forever. I think there's only been one disease so far, smallpox, that has been eradicated. I gather that guinea worm is very close to that, but not quite there. The foundation wants to eradicate, 3? Polio, tuberculosis, malaria? Is that right?
Well, we would love to eradicate all of them. That would be a disease-free world, would be a wonderful goal. And you're right, to date, only one human disease, smallpox, has been eradicated. There's also been one very important animal disease, rinderpest, for livestock that has been eradicated, because we also work on agricultural development and livestock. And yes, that is the goal. We are excited and think that it's very achievable with both guinea worm you cited, but polio, which has been a much bigger scourge for many, many years. And also malaria is one of the others that you mentioned that we're most optimistic about what can be done. Tuberculosis and HIV, between them, tuberculosis, HIV, and malaria make up the 3 largest infectious disease killers that disproportionately affect poor countries. And we'd love to see a world where all of those are eradicated. But we understand for both tuberculosis and HIV, it likely will be a bit more of a stretch. By the deadline that we're giving ourselves of what can we do by 2045, I think our hope is more that we can control those diseases and bring mortality and incidence rates down in low-income countries to where they are in a country like the United States today. But we absolutely are hoping that malaria and polio will no longer be with us.
Polio in particular is striking based on the numbers that I've seen. How close are we to eradicating polio?
Well, we're very close, but also not as close as we would like to be. It's a perennial problem where The actual number of cases of wild poliovirus, which is the naturally arising version of the disease, is essentially, in the low 2 or 3 figures, depending on globally.
Globally, what, 100 or fewer than 100 people have this? That's all?
That's it. But the challenge is those people, it's where they are. They are in Afghanistan and Pakistan, and they are in rural, inaccessible, highly politically unstable areas of both of those countries across a porous border. And the challenge with polio is, it creates reservoirs that the disease, the virus spreads, and only a subset of children get the disease. So those single digits actually reflect a much bigger spread of the disease. And so we work with a full range of partners, local partners on the ground, the governments where we can, although you can appreciate in Afghanistan, working with the Taliban government we don't do that directly. We work with the World Health Organization and others, and the Pakistani government. But again, we are making progress. They're very committed people, vaccinators on the ground. And so we're really hoping in the next year or two, we will bring that down to 0.
But if there's one that you don't get, then
as long as there's one, there's always a risk it can come back. And that's why this is a global effort, because every kid in the world still gets vaccinated with polio. They have to, because if it's anywhere, it could still spread back. Kids no longer get smallpox vaccinations because it's essentially gone outside of a couple of labs. For polio, and that's why it would be such an amazing global health event for the world. It would be massive cost savings, even in high-income countries like the US, and obviously an enormous public good in terms of just the suffering for families, parents, affected kids that would be done away with.
Another surprise, I think at least for many people, is the number of people who still die from malaria. Where do we stand on that now?
Yes, well, malaria is incredibly challenging disease because it's both the deaths, and the deaths are very high, the majority of them children. So it's the kids that actually most get to us. And it's the fact that in the rich world, it's not seen as a problem, because if you or I are going to visit a malarial area, we can just simply take an anti-malaria medicine, a prophylactic, which means we won't be infected while we're there. People who live in malaria endemic areas don't get that opportunity. And so you need something more radical. And we've got multiple, we call them shots on goal, of how we're trying to do that, through vaccines, through treatments, through prevention, some as basic as bed nets, some as elaborate as actually seeing if we can stop malaria carrying mosquitoes from actually being able to breed over time. And so we're trying to pull all of those together and try and tackle that deadly disease.
Yeah. It is striking. One of the many interesting things I've learned in looking into all this is something you know very well. But if you ask people, what animal kills more humans than any other animal, almost nobody guesses the right answer, right?
Absolutely. That's one of the reasons why one of the most popular and widely looked at things that Bill does on his personal blog is called Mosquito Week, which is taking on the famous Shark Week that goes on TV, because people think of sharks as deadly, and we go, actually, it's mosquitoes. They're deadlier than any predator. Sharks, lions, crocodiles, you name it, the mosquito is the biggest killer by far.
And then tuberculosis, which again, in the rich world, we don't even give a thought to it.
Not any longer.
Anymore.
But it's as recently as 150 years ago that in the United States or Europe, it was a disease that affected everybody and was on everybody's mind. But yes, that's been brought under control in the rich world, but it is still the largest killer. It recently regained the crown that no disease wants over COVID. And it's a very challenging disease, huge impact on adult populations, in this case, largely across Africa and Asia. And just a huge public health challenge.
But tuberculosis vaccines have been around for a very long time, right?
There's one tuberculosis vaccine that has been around, but it's only partially effective. It's been used and has not had there's a vast range of differentiation of how effective a vaccine can be. And so one of the paradoxes has been, even though it is the largest killer, there's been no new research done into new tuberculosis vaccines that could be more effective. And so one of the signature things that we're doing right now is we're putting hundreds of millions of dollars into it, so that's the scale, the first large-scale trial of a tuberculosis vaccine in over a century, which we're hoping will be exactly that, transformative. If we can prove that it's a high-impact tuberculosis vaccine, that could change the face of the disease. But paradoxically, that has not been funded by the private sector because they don't see enough potential return, because they would need people suffering from TB in high-income markets like the US to get the return. And governments haven't invested in it either because essentially it's a public good that is a market failure.
So some of these objectives of eradicating or virtually eradicating certain diseases, some of them may not be reached by the 20-year shutdown. How would one imagine that the trial there, the attempt, the goal will be carried on by others?
Yeah, and it's a great question, and a really important one, and one we spend a lot of time thinking about. And the key is what we are confident we will be able to put in place within the 20-year timetable is the tools that can be used to finish the job in both HIV and tuberculosis. Right. That we will have the treatments, we will have the vaccines, we will have the other sort of prevention tools like advanced bed nets in the case of malaria is the equivalent of. And that what we actually will need then is just an infrastructure of, let's call it the delivery tools. What's the infrastructure that's able to make sure that those tools are then rolled out? And that is primarily actually the job of governments. So it is the government of India, for example, has made eradication of tuberculosis a national priority under Prime Minister Modi. The government of South Africa has the same, Indonesia the same. These are countries with very high TB burdens. And so a lot of what we're working on is working with those countries to make sure they have the infrastructure and the resources able to take on the delivery and implementation, and then working with global partners like the World Health Organization and others to do that. So what you'll need is a full array of sort of supporters, both funders, but the primary funders of delivery are always going to be the governments themselves. That's the, and then that you'll need an enabling set of partners like the World Health Organization, but hopefully the hard job of creating what are the tools that will allow you to eradicate the diseases. We will have done that.
Right. And on that topic, you mentioned something that is part of a broader theme, which is getting a vaccine actually manufactured in large quantity is sometimes difficult because the economics just don't appear to work for a company that is capable of producing these vaccines in large quantities. But you have also, you, the foundation, have also found ways to get around that or to change it so that the vaccines are economically viable. Can you explain how that works?
Yes, so that's, I think, one of the things that I'm proudest of what the foundation has helped do and transform the field over the last 25 years, which is showing there is a model where you can pool funds, largely public funds, but also philanthropic resources. In the case of vaccines, through the creation of the Gavi Vaccine Alliance, which is a coalition that we helped put together actually in the first year we were set up in 2000. And what that is, it said, we believe we can actually prove there is a long-term viable market for vaccine manufacturers to manufacture at scale with high quality at low cost and still be profitable. And in exchange for guaranteeing a market, we pool those resources and we will guarantee, we say, if you are able to manufacture at this price point, at this quality, and at this scale, we will guarantee to purchase those so that the manufacturer has a confidence to go ahead and do it and distribute them to those in need. And that model has been incredibly effective in driving down the cost of vaccines. So most of them are less than half or even bigger price cuts than what they were 15 or 20 years ago. and that allows you to then reach 2 or 3 times as many kids. You can also do it in tools. One of our other more recent is there's the HPV vaccine, which is the vaccine to prevent cervical cancer. Now, the companies that have manufactured a highly effective vaccine, this is an example of a vaccine that really has a very, very high effectiveness rate. Their trial said you needed to take either 2 or 3 doses of the vaccine for it to be effective. Now, if you're a vaccine manufacturer, you would like 2 or 3 doses to be purchased because that improves your profit line. We wondered whether actually just a single dose might be effective. And nobody was willing to do a trial because these trials are very expensive. So we funded a trial to test whether a single dose HPV vaccine could be just as effective as multiple doses, and proved that it is just as effective. And then what happened was actually the first country to take that up and implement it in their national platform was the United Kingdom. Because they saw it saves them a huge amount of money in vaccinating their children. And once the United Kingdom did it, that gave a degree of comfort to countries all across the world, the Gavi Vaccine Alliance, again, to change their dosage regimens. The WHO guidelines changed. And that's an example of where simply a study done by the Gates Foundation, which no one else was willing to do, can actually help catalyze both increases in volume, because then these vaccine manufacturers are manufacturing scale, and you obviously reach twice as many kids if you only have to vaccinate them once.
Right. One thing that we should make clear is, where are you operating primarily? In other words, these diseases we're talking about, these problems we're talking about, where are they concentrated most? Where are the most important places for you to do what you do?
Yeah, so overwhelmingly, the largest footprints of disease and poverty in the world today are still South Asia and Sub-Saharan Africa. So those are the 2 main geographies we work in. Actually, when we started the foundation, the bigger disease burden and poverty burden was actually in South Asia.
South Asia being what, mostly India?
South Asia is India, Pakistan, Bangladesh, Sri Lanka, that broader environment. And we also work in kind of bigger countries in Southeast Asia like Indonesia, the Philippines, and others, but really South and Southeast Asia. And there have been significant improvements. There's still big disease burdens and challenges, but the biggest remains Africa. And tropical Africa always, for a variety of historical and geographic reasons, has always been there that, for example, suffers the most intense malaria. And so those challenges are there, and those are many of the poorest and most vulnerable countries that often don't have the resources themselves to tackle these. And so that's why building a set of partnerships with local governments on the ground has actually been one of the other big shifts we've made over the course of the last 2 decades, because we know we need strong, engaged partnerships on the ground in the countries and communities where the people are being affected in order to achieve our goals.
Yeah. It's worth taking, at this point, we're talking about serious diseases and the fight to eradicate them, or at least enormously diminish them. There have been some wonderful results already. I think of the fact that when the foundation was begun, I think the number of kids under 5 years old who were dying every year was about, 10 million?
Yeah, over 10 million.
Over 10 million, and now it's a little under 5 million.
But by far the biggest single contributor to that drop. And it is an amazing drop when you stop and think of that, because those numbers, it's so easy to think of them as statistics rather than people. But each one of those, and that's every year. Yes. It's from over 10 million preventable deaths a year to under 5 million preventable deaths a year now. And the biggest contributor absolutely is vaccines. That's by far the single biggest contributor, has been that greater rollout of vaccines for these highly infectious diseases, and the benefits we've had. But then there's a whole range of follow-on treatments that we also work on. For example, just very basic steps that allow for safer birth, antenatal and postnatal care for pregnant mothers in rural health settings, primary healthcare clinics in whether it's rural Uttar Pradesh in India or rural Ethiopia in Africa, where we can provide tools, techniques, training across that whole spectrum. But vaccines has been the biggest for the first 25 years, for sure.
Well, and that's very interesting, because I think that the foundation is the largest global funder of vaccines. Is that more or less correct?
I think of probably research and development into vaccines for diseases that proportionally affect the poorest. Yes, I think that's absolutely true.
Right. Well, and what I'm getting at is, can that decrease from more than 10 million to less than 5 million? Can that be attributed to at least some degree to the foundation?
Well, I want to always be really careful to say it takes a whole array of partners. That Gavi Vaccine Alliance, we use the word alliance deliberately. Right. It's an alliance of donors, wealthy countries, including the United States, that have made significant contributions to pool that financing. It's an alliance of implementing partners, UNICEF, the World Health Organization, other partners. It's an alliance of national governments prioritizing it with their own health ministries, and ultimately it is the practitioners on the ground, the men, women who go out and do the vaccinations and do the training. So yes, I think we like to believe that we've helped catalyze a lot of that, as we described, that our thinking around how you can bring down the costs, improve the access, improve the training has helped, but it absolutely is a partnership rather than something the Gates Foundation does directly.
Yeah. You mentioned just in passing a while ago about the importance of getting these vaccines or whatever else they are actually delivered to the people who are going to get them. And I wanted to dive a little deeper into it because it is a very difficult thing in many of these places. Getting to the people who need these things isn't easy in some cases. In fact, it's very difficult in some cases, as I understand. You can't, as you mentioned, that takes a lot of people to get out there and deliver these things. The foundation isn't going to, manage all of those people. Can you tell us in a little detail how you get this done?
Yes, so this has actually been one of the big, I think, evolutions of the foundation from the original concept when Bill and Melinda started it in 2000, where I think they really thought and hoped that most of our work could be in let's call it the pure upstream, the research and development, that we could help create some of those public goods, because we're an entity sitting in Seattle. It's very far away from those geographies, sub-Saharan Africa and South and Southeast Asia, and that somehow the system would make sure those reached the people who needed them. And Bill and Melinda learned over time, and the foundation learned over time, that system doesn't exist as a system. There are partners, there are entities, there are different things, but we actually have to help incentivize that, work with it, provide the financing, provide new tools, provide data. One of the key issues that we also has been transformative, and I think the Gates Foundation can take a lot of credit for, is just helping better understand what were the causes of child mortality. Because you need to know who's dying of what in order to then figure out what treatment or vaccination is most going to impact it. And for those over 10 million deaths a year at the beginning of 2000, we didn't know. They were just big categories of what we call verbal autopsies. We think the kid died of pneumonia, and you don't really know. And so part of what we've done is put in place research. We've had an initiative called CHAMPS that actually identifies the cause of and that helps then better direct both the treatment, where the research should be, and in each of these cases, again, it's finding a full array of local partnerships. Can you be the Gavi Vaccine Alliance or the Global Fund to fight AIDS, TB, and malaria are probably our two biggest signature examples, because those pool together the resources in one level, are able to mobilize the private sector to provide the tools, and then work directly with the governments and other implementing partners to reach those on the ground. Because you say that is not a role for a global foundation, that has to be done through health systems.
Yeah. And you mentioned the value of the data that you use. And maybe it shouldn't be surprised that a foundation founded by two people who were in the software business are very, very data driven. But my understanding is, yes, that the way the foundation works is very, very data driven. What have you done to build that up and to make it a differentiator?
Yeah, well, it's data driven at two levels. Yeah. Level one is how do we help the world better understand where the challenges and opportunities are? That is, what are the real causes of childhood death in these low-income countries? That's data that anyone can, it's a pure public good. We do it in some of the other areas we work in, for example, like in our agricultural development, which crops are going to be best used in which soil or rainfall things to be as productive as possible for smallholder farmers who need them. And so we do a lot of that research for the field, both informs our own work, but it helps people in fields outside of ours as well. And then there's the data around the specific projects. Is it reaching them? Another good example of this was when we went heavily into family planning, starting in 2012, when Melinda made a big announcement with then Prime Minister David Cameron in the United Kingdom, where we set a goal then of trying to reach 120 million additional women with family planning products by 2020. Because what had happened in the field was there were lots of discussions and declarations about how critical family planning was, but there wasn't really tracking, well, are extra family planning products reaching the women who most need them? And so we helped put that in there. There was an entity we helped create there called FP 2020, now with the 2030 deadline, it's now called FP 2030, which tracks a lot of these issues, because you want to know, are we achieving those goals? Is it reaching the people? Are those lives being saved? Are they getting a successful family planning product? And so data is at the heart of everything we do to help guide, to help course correct, because the data, is it working or not? Do you need to do a different plan? And so, yes, that's very much, the combination of data, looking at where there is. We clearly, with our founders, have a bias towards technology as a source of innovation that can help drive transformative change. And then are there ways to catalyze the private sector to provide some of these public goods? Those are all three areas where we go, yes, that's probably distinctive to the Gates Foundation because of our mission and vision. But we understand that success comes through ultimately public sector provision of these services.
Yeah. A very much related topic from what we've just been talking about is that you have been a very strong advocate for more education for women, more business loans for women. What's the progress that the foundation has made on that?
Yes, so on gender equality writ large, that's also an area where we evolved a lot, because I think we assumed, and Melinda actually writes about it very eloquently in her own book, The Moment of Lift, that if we were doing these public goods, call it in the first decade of our life, they would reach women as well as men. That they're just a vaccine is a vaccine. It's gender neutral. And then we learned over time that actually it's not. Almost nothing is fully gender neutral. You need a degree of intentionality and focus. Again, if you take our agricultural development work, which focuses on smallholder farmers who are the poorest of the poor in rural areas, and you go, over half of the farmers are women. But we also know that women have access to smaller plots of land. They're less likely to be able to have title to their land. They're less likely to be given loans. They're less likely to be given extension services by the government. They often have less time available because they have more household duties. So you can't possibly have an aggregate goal about improving agricultural productivity or farmer income unless you're deliberately targeting the challenges faced by women. And so in each of the areas where we've worked, we've developed what we call a sort of intentional focus of trying to say, what and where is there a particular gender dimension that we could and should be looking at, especially in the economic empowerment area, in financial inclusion, access to tools to get access to loans, credit, other tools like that, in the agriculture area, and certainly in healthcare. It's also been the diseases that disproportionately affect women, or challenges that affect women, often are under-researched and underinvested in. So we have now developed, we actually set up just over 5 years ago, which was one of the first actions I took on becoming CEO, was actually putting a lot of our work together into a gender equality division to actually say we need to be able to think about that and focus on that in a broad way, cutting across all of our health and economic empowerment areas to help drive that. It's not an either or, it's still part of the rest of our work. And there, yes, there has been progress, but there's always a lot more progress that needs to be made.
Your second biggest focus at the foundation, after global health, is agriculture. Getting better food and more food to people who really need these things. What are you doing that's innovative on that?
Yeah, so, well, first it's food and income, because it's actually the rural poor, which are our focus, tend to be the world's very poorest. Those who, when we use the term extreme poverty, you're living on $2 a day or less, roughly. Those are overwhelmingly, 70% of them are rural smallholder farmers across Asia and Africa who depend on agriculture both for food but also income. And so what we're trying to do is both help improve their productivity. So a huge amount of our research, the equivalent of our health research, goes into ways, can you make more drought-resilient maize, which is the chief staple in East and West Africa, or flood-resilient rice, which is the chief staple in India or West Africa. And so you improve productivity. We're also then trying to connect them to markets, so that how do you create markets? Often it's markets in crops like cassava, which you wouldn't think of in your local supermarket, but is incredibly important in a place like Nigeria. And can those become income generating opportunities? What are the policy frameworks that governments can help put in place to help incentivize and support that? And then, as I mentioned, having a particular focus on women farmers, often within that context. And so all of that comes together and provides both long-term sustainable income generating opportunities for these smallholder farmers, who then able to overwhelmingly invest it back in their own families, put their kids in school. Those are the kind of success stories that we like to look for.
The 20-year future life of the foundation, what were the talks? What was the thinking behind doing this? Why was this even thought of? How did it come into being?
Yes, so this was something that started being discussed at our board with both Bill and Melinda, while Melinda was still on the board, where we were thinking through, how and where is the foundation going to have its greatest impact? And that both looking back, and we were always looking at our 25th anniversary as a key inflection point to think about some of these issues and saying, based on what we've learned of how and where we can be successful and impactful, especially in the global health space with some of the key, what do we think can and should be done now? Because we've always been about trying to address today's problems, not tomorrow's problems. And in that context, at the level of spending that we were committing to move up to, which we'd already made the commitment to move up to a steady state of approximately $9 billion a year by starting in 2026, we think, how long can we continue at that level, give or take? And what goals could we achieve of the major goals that we are aspiring to? And especially in the health space, I say the eradication control of deadly diseases is the biggest part of that. And looking at that, we thought, actually, we can make that critical difference now, in this key time period, with the tools and the pipeline of innovation we have, which we're incredibly excited about, and sort of the track record and lessons that we've developed over the last 25 years, this is the key period to achieve that goal and vision. And so that was essentially how it all came together. We then worked through the details. We didn't have the exact deadline at first. We were working through some modeling of both, the goals and the resources available. And in the end, it was Bill finally working with the board that came to this conclusion that this was going to be our goal. While we've talked about the amazing successes we had, the bulk of those successes have been in the first 20 years of the foundation's life, between 2000 and 2020. With the data, it became clear as we were looking at it in the course of growth that 2020 actually marks an inflection point. Yes, it was the start of COVID, but also it's where a lot of that progress started flatlining. We've talked about child mortality, but there'd also been a halving of HIV deaths, a halving of TB deaths, a halving of malaria deaths over that first 20-year period. All of that stalled and began to reverse in the 2020, 21, 22, 23 period. And there was a slowing of the progress in child mortality and these other tools. And so looking at that and looking at our role as a foundation, we thought this is a problem. That some of it was triggered by COVID, but it's actually then been accompanied by a lack of additional resources coming from some of our traditional partners, a lack of focus on these kinds of health outcomes, a loss of belief that progress is possible. And so all of you came together and said, well, what's our role? We need to be the place that actually can signal that it's safe to be optimistic about what can be done, that there are incredible opportunities to actually accelerate progress and bend that curve, and that we want to both be part of that, a catalyst for that, and demonstrate what it can look like. And that was a lot of also what was pushing us into saying, okay, we need to bring forward our deadline and make sure that we are driving through these opportunities that we see right now, whether it's an HIV opportunity, an agricultural development opportunity. And so that also has pushed us to make the decision now.
We are seeing in the U.S. and other countries a pullback on foreign aid. What's the effect of this? What is the effect of this on your work?
Yes, well, clearly foreign aid, the generosity of wealthy countries, has been a critical dimension of a lot of the progress we've talked about. They've been the primary funders of entities like the Gavi Vaccine Alliance or the Global Fund to Fight AIDS, TB, and Malaria. The US has been the champion of both PEPFAR and the President's Malaria Initiative, which have been critical programs for HIV and malaria. And that's been a huge part of the success. And so as there have been sort of declines and pullbacks and debates on the utility of foreign aid, we do see that as a challenge. And what we really try and do is unpack. The word foreign aid, I find, or the two words, extremely unhelpful because it covers. But when you talk about life-saving assistance or stopping a pregnant mother from passing HIV on to their child, or helping a hungry infant get the nutrition they need to make sure their body and brain fully develop, I think those are, and we strongly believe, those are incontestable public goods that are in the national interest of the United States, of Europe, of all of these other partners, and we're trying to shift that discussion and make sure the discussion is about concretely what and when and where are these resources going to be put to their highest good. And so our hope is absolutely by focusing those discussions, we can actually preserve a significant amount of global support for these interventions, and but also fully understanding that over the long term, the primary obligation for making sure those treatments reach those in need comes from the countries themselves, the recipient countries. And so, yes, it's a challenge, but it's one that we feel we are optimistic about being able to sort of tackle and see if we can just bring in both or strengthen traditional governmental support, but also look for new partners in philanthropy and other areas.
We've mostly been talking about the work that's being done in other countries, but the foundation also has a U.S. program that is important, which has to do with education, particularly secondary and post-secondary education. What's the objective you're trying to reach with this?
Yes, so we've had that right from the start of the foundation. It was incredibly important to Bill and Melinda that we do have a strong focus in the US as well as globally. And while globally they were quite analytical about picking the area where we were, which is how we've ended up in health and agricultural development, in the US they felt personally so strongly that they had been beneficiaries of an education system that had provided them opportunities that were denied too many other people, that is where they wanted their focus to be. And so we picked it, and then we're looking for areas of how and where could we be impactful at scale. And there it has been, and I think Bill is the first to acknowledge, much more challenging. If you'd asked them both in 2000, which is going to be the area we're going to see the greatest success? Is it going to be global health or US education, and which will be the most challenging? We'll go, well, that health space looks very difficult, but we're confident we can make progress in education. And looking back 25 years later, we go, actually, it's been a little bit the other way around. The real progress at scale has been in the global health space. In education, we've had some amazing successes around improvements in graduation rates, in different kinds of models around curricula, training, focuses on students of color in particular. We've had the Gates Scholarships, which have been a tremendous vehicle. But we haven't seen that same kind of massive progress at scale where you see across the country there have been improvements. In fact, there have been some significant setbacks. And so we've been looking and constantly adapting about what and where is the best role for philanthropy, where currently our primary focus is around curriculum and the improvement of curriculum, especially in math, because there's a very, very high correlation between success in math between 9th and 12th grade, and then success going on to college, and then through college into a sort of productive employment. And so that's a big focus right now. And we've also been doing some very exciting work, which we started doing about 8 or 9 years ago, around economic mobility and opportunity beyond, because there's also a connection around, you want to make sure, how do people get into the workforce? How do they get access to tools and resources that are able to do that? So it's a smaller body of work, but it's a very important one.